Welcome everyone to yet another exciting day at the Muggles Potions Masterclass, your survival guide to pharmacy practice in Malaysia. This is where we deep dive into the topics that we face every day in the Malaysian hospitals. If you're a PRP or a pharmacist trying to survive the magic of a Malaysian hospital without getting hexed by the workload, you're in the right place. Let's get to work.
Hey, welcome to The Explainer. Today we're going to break down the Malaysian clinical practice guidelines for a major cardiovascular emergency, non-ST elevation acute coronary syndrome, or NSTE-ACS for short. And if you're a healthcare student, especially a future pharmacist, you're definitely going to want to stick around for this.
Okay, so why should you care about this? Well, let's get right to it. The bottom line is, ischemic heart disease is the #1 killer in Malaysia. So knowing how to handle one of its most common forms, yeah, it's not just for an exam. This is real-world life-saving stuff. So what in the world is NSTE-ACS? Well, think of it like a sudden plumbing crisis in the heart. The heart muscle is screaming for oxygen, but the supply lines, the coronary arteries, are getting clogged up. You've got this dangerous imbalance between supply and demand. It covers everything from unstable angina, which is like a serious warning shot, to a full-on NSTEMI, where heart muscle cells are actually starting to die.
All right, so here's our game plan. We're going to follow a patient's journey, starting with what's actually causing the problem. Then we'll look at the first response, how we diagnose and assess risk, and then we'll do a deep dive into the medications used in the hospital. And finally, we'll touch on the road to recovery. Ready? Let's get into it.
All right, first things first, let's get to the bottom of what's actually going wrong inside the arteries here.
So this is super interesting because there are basically two main ways this can happen. Type 1 is the classic heart attack. Imagine a cholesterol plaque that's been building up for years suddenly cracks open, and a clot forms right on top of it, blocking blood flow. But then there's type 2. This is more like the heart's engine is redlining, but the fuel line can't keep up, maybe because of severe anemia or a dangerously fast heart rate. And telling them apart is crucial because for type 2, you treat the underlying cause, not just the clot.
Okay, so a patient comes in with chest pain. Now the clock is officially ticking. What happens next, both in the ambulance and at the hospital door, can literally change everything.
So the second they hit the ED, a whole sequence of events kicks off. It's a rapid-fire protocol. First up, they get a big 300 milligram dose of aspirin to chew. Why chew it? For super fast absorption. It gets to work right away, basically telling the platelets to stop being so sticky. Then, GTN to open up the blood vessels and ease the pain. If that's not enough, IV morphine can really help. And at the same time, we start an anticoagulant like heparin to stop the existing clot from getting any bigger.
Okay, the patient's immediate crisis is being managed. Now the team has to do two things at once: confirm exactly what's going on and figure out just how bad it is for this particular person.
And this is a really important point. There is no one-size-fits-all treatment here. Every patient is different. This idea of risk stratification is key. It's all about figuring out, is this patient low, medium, or high risk for another major heart problem? Because the answer to that question dictates the entire treatment plan. So how do they do that? They don't just guess. They use these really smart scoring tools, like the TIMI score or the GRACE score. These scores crunch a bunch of data, like the patient's age, their kidney function, what the ECG looks like, and those cardiac blood tests, and spit out a number that tells us the risk of something bad happening soon.
But here's the catch. It's always a balancing act. We're throwing all these powerful drugs at the patient to stop clots. But what's the flip side? Bleeding. And that can be just as dangerous. So that's why we have another scoring system, like the Precise STAPT score, to figure out the patient's bleeding risk.
Oops, let's all take a break right there so that we can continue absorbing like a sponge.
Class dismissed. Remember, a great pharmacist doesn't just dispense, they protect. One wrong potion can change everything, so stay sharp out there on the wards. If this lesson helped you feel a little less like a muggle and more like a master, make sure to click the like button and subscribe to the channel. It helps me keep the laboratory running. See you at the next ward round.